Hello, my name is Ashley, this is Faithful Rattos, and welcome or welcome back. So in today's video I'm going to be talking to you about open wound management or open wound healing. You may have heard it be called a bunch of different things, but I think this is something that a lot of rat owners will run into at some point in their life, whether that is because they have a rat who will not stop chewing their surgery incisions or because of abscesses or a bunch of other things. This is something that I think rat owners at some point will have to deal with, maybe on a small scale or on a large scale, and so I thought this was a helpful video to make, and I really enjoy making helpful content here on my channel based on my own experiences, and I think that's why people like my channel. So yes, let's get into it. Open wound management, what do I mean by this? This is when we are letting a wound heal by itself without surgical intervention, stitches and things like this. Obviously we are keeping an eye on the wound and we're keeping it clean and things like that, but this is pretty much letting the wound heal by its own volition, relying on the rat's immune system and metabolism to do the work and letting them do it. So there are two main scenarios that I would say are appropriate for open wound healing when it comes to our rats. The first one being a rat who is consistently interfering with stitches or a surgical wound, and at some point it gets to a line. You draw a line in the sand and you stop going in, putting them under and stitching them up, because the more that you stitch up and it continues to open, the less skin you have to work with, and also there is increased risk of multiple anesthesia usages. So that is something that is also at play there. So that is a lot of the time vets will decide to do open wound management in that circumstance, and I do have friends who have dealt with that before and their rats have healed up beautifully. The other one is abscesses, and this is one that I have dealt with. So abscesses are very, very likely to reform or sort of rebuild up if you aren't leaving drainage for the pus to come out, and this is what happened to me. So open wound management when it comes to abscesses is also very common in rats, and I think is something that is the right decision than stitching it up. And I want to give you a little bit of a pep talk if you are dealing with this with your rats. I know how stressful it can be, I know how gory it can look and how just how it will turn your stomach. But listen to me when I say this, it will be over before you know it. Rats are excellent healers. Evolutionarily, they have to be, being prey animals with such a short lifespan. Their metabolism is so much quicker than ours, and it means that they can heal at lightning speed. Now, most rat owners will have experienced a tension slice that they can't even find the next day, and that is just how quickly rats heal, and that's what makes them awesome healers and awesome at surviving, and part of the reason why open wound management works so well for rats. I have no idea how valid of a option this would be with other animals, but with our rats, it is a pretty good option in some circumstances. So yeah, don't worry too much. I know it's scary and it feels very, very stressful at the start and a lot of responsibility, but once you get started you will see just how quickly they can turn things around. And honestly, I was thoroughly shocked by like 2 days in at how fast it was healing. So yes, it is scary and it is stressful, but it is totally possible, and they will surprise you. They will shock you and you will be so proud of them. And yeah, so please, if this is something that you are going through right now and you're really worried about it, please don't be. Obviously still have that monitoring from your vet and keeping a close eye on it and things that I'm going to mention in a second, but it will go by so fast. You will be shocked, okay? You'll be okay, and your rat will be okay, I promise. What do you need to do? The first thing that I think is really important is that you have a vet monitoring the situation. This is not something that I recommend people do without a vet at hand, but if you have a situation where your rat has been chewing through stitches repeatedly or has an abscess and things like that, I think in a lot of these circumstances the vet is already involved. But if the vet is not already involved, this is something that the vet should be involved with as well, especially if the wound is on or near the face, and especially if it is on the ball sack area for male rats, because those are wounds that sometimes we just need to neuter them and the balls away. But yes, I think there should be a vet involvement, but a lot of this is what you're doing at home and how you are keeping them. Obviously, the first thing that you need to do when it comes to doing open wound management is keep that clean. Now, rats will do a good job at keeping themselves clean and their wounds clean, but we do need to help them out, and we have a couple of different options on how we can do it. So you can use diluted hippie scrub, make sure it's diluted, make sure it's diluted. You can use things like Lucillin spray or F10 spray. Other barrier sprays, I used Lucillin and it worked great. There are lots of different options. Personally, I think whatever you can get your hands on the quickest is probably the best bet. That's why I ended up going with Lucillin. But yes, something to keep it clean, you can use saline or boiled salt water. If you don't have anything else to hand, those will be fine. You just need to make sure you're keeping the wound clean and keeping any dirt and debris off it and making sure it's infection free. Another thing that people have great experience with, but something I haven't personally used, is Manuka honey. The medical grade, make sure it's medical grade. The medical grade Manuka honey has amazing antibacterial and antimicrobial properties and really does aid in healing. It's not something that I've used, but it can be used. My vet says you can use it, but when it comes to rats, you may get interference from the other rats licking it off. So sort of checks and balances. In your circumstance, do you think it would be helpful? A lot of the times, if you have an open wound that is sort of got a pocket underneath the skin, putting the Manuka honey inside can be very helpful, but in my circumstance it was an open wound with no sort of pocket area, so that was okay. So that is something to consider. The second thing, and this is a really, really important thing, is pain management or anti-inflammatory. You can do things like NSAID, so Metacam or Loxicam or whatever it is called, by your vet, whichever one they're using, or you can do things like a gabapentin or something stronger like buprenorphine. I can't say it. I'll put it on screen. Make sure your rat, for the majority, especially at the start, is on pain meds, so this will stop them from interfering with the wound, but also for anti-inflammatory purposes, because this will help the wound to not be swollen and as puffy, and it will help it to stitch together if it's not so inflamed. So that is really important as well. The third thing is you might want to consider antibiotics to cover the wound. So we were prescribed antibiotics to cover, just as a baseline to help the immune system so that it's not worrying about fighting off other things. If you have an abscess, you may be treating with a particular abscess because of the infection that your rat had. That is something to consider as well, but I do think obviously that is up to the vet's discretion. And if they feel like antibiotics are a good idea just to cover all bases, I think this is one of those times where it's appropriate to use them prophylactically. I wouldn't just say like whip out antibiotics for any old thing normally. When it comes to this, you want to have the least possible infection risk, and giving a cover antibiotic can help with this. That's another thing. Your vet might also give you an antibiotic topical cream, which might help in the healing as well. And the fourth thing, and this is also super important, is to have them in a hospital cage and limit their movement, especially if your rat's wound is in an area that is likely to sort of be pulled with movement, with climbing and things like that. Keeping them in a low level cage where they don't have to do that climbing is really important, especially in the beginning stages of the healing journey, just to ensure that you're giving the best possible chance for the body to be able to do its job without sort of putting extra pressure on the wound and risking the wound reopening and things like that. So yeah, that is something also to consider when it comes to open wound management with our rats. So I'm going to tell you my story of Kiru. I'm going to put a picture on screen here. Hopefully he'll wake up at some point today and I can show you him and his fully healed up little scar. This is Kiru. So Kiru is one of my recent babies that I got back in August. He's a little Siamese. He's very cute and very special. I'm hoping that I'll be able to announce something exciting about him in the next couple of months. However, during intros, it's actually on my channel, during the intros in the vlog that I did that was called like one of the hard weeks of being a rat keeper or something like that, he was bitten during intros, and it was the tiniest little bite. It was just so small. There's a tiny bit of blood. It wasn't massive. He didn't even seem to notice or be bothered by it, but he was bitten and it was very small. I did clean it out, like just a quick clean out, but I must not have cleaned that out very well. And I think you can become a bit complacent when it comes to the smaller wounds and not cleaning them, and not being as vigorous when cleaning them, because they're only small and they'll heal up fine. But it is something that I kind of wish I had cleaned it out a little bit better, and maybe we wouldn't be in this situation now. But anyway, And after about 4 or 5 days after that happened, I had a health check with my vet because of her mobile services. She does twice annually health checks so that she can do online consults, and I find them very useful. And she found a little abscess on him during that check, and I had been keeping an eye on it for about a month before it came to a head. And it was a weird shaped abscess. It was kind of like teardrop shaped that you could feel under the skin. It wasn't very deep and it wasn't like very high. It was quite shallow and it was teardrop shaped. And I was keeping an eye on it and I was warm compressing it, and then eventually it got a little scab on it, which means that it meant that it was coming to a head. And eventually it did come to a head, and it just didn't seem like I could clean it properly. Like there was pus that would like dried and stuck to the skin, and I was quite worried about it because it wasn't coming off even after weeks and weeks of warm compressing. So that's when I made the decision to take him to the vet to get it cleaned. This is another vlog that was here on my channel. He went the same day as Toast did to get his post-neuter abscess cleaned, and the vet took him in, sliced it, cleaned it and stitched it up. And here was the mistake that was made. She didn't leave any drainage, and so as the wound healed, wherever the abscess had come from had continued to create pus, and it built up and it built up. And then one morning, very early in the morning, when I was on my way to a rat show, I woke up and his wound had opened. And I will just say I'm going to show all the pictures on the screen now, so if you are squeamish in any way, don't look at the screen. It's going to be a lot of them, so if this is not your cup of tea, then maybe don't watch. So it was pretty gruesome. I was going to a show early that morning, so I cleaned it out as best as I could, and then I talked to the vet and we went back in on the Monday. So that happened on the Saturday. And when I was at the vet, and this is part of my vlog as well, the vets that were there at the time, they said, we don't think we should close this up. We think we should leave it open. If we were to close it again, it's likely to just collect pus again, and we think that open wound management is the best course of action here. So when I left him there, they did a good clean of it when he was awake, just to give it the best possible shot. And then I was recommended a few different products that I could use, Hibby Scrub or Lucillin or F10 spray or anything like that. And so I had ordered Lucillin already for Toast's situation, so that's what we were going for, and we were keeping it clean. And I was also prescribed antibiotics to cover during the wound healing process, and he was on Metacam Loxicon, the dog version, and he was on a pretty high dosage twice a day. I don't think it was the maximum dosage, but it was a pretty high dosage to ensure he wasn't in pain and that the inflammatory response of the body was kept down. So he was on that. So I'm going to put on screen on the side here a collage of pictures week by week and sort of give you the main points of healing. Now these pictures were taken in the evening. I found that there was more difference in the wound in the evening than there was in the morning, and I think my friend Sarah from Marigold Rats actually came up with this. I think it's probably because they sleep more during the day than they do in the night, so their body has done more healing during the day. So when I check in the evening, there is more progress. So these are the evening pictures, starting with the day after we went to the vet. So this is week one. Week one, the biggest things and changes that happened was, first of all, the scabs and the dried up dead like skin and the nasty abscess material that had dried onto the wound that fell off within a couple of days. And the little divot, which is what I think the original bite caused and where the original abscess material was, that kept refilling with pus. It was very, very shallow and nothing really to be concerned about, but that little divot kept refilling with pus during this week. Then week two, you could notice how quickly it was closing, especially at the top of the wound. You could see it closing up there. And this is when I noticed this sort of lumpy bumpy at the bottom of the wound. And this is where the abscess originally opened up after being at the vet. And so I think, and that's where the original material was collecting, and I think that's what happened. And I think it was a bit of scar tissue actually, that little bit at the bottom there. And I kept an eye on it, but it was closing really rapidly, and you could see the difference every time that I checked on the wound. So every 12 hours when I checked on the wound, you could see the difference, and it was actually scary kind of to watch just how quickly it was changing. Then week three, this little tiny mini abscess formed on the side of the wound. I don't really know why that happened. It really resolved itself quickly. I didn't really have to do anything with it, but it was very weird. That happened, and it just kept continuing to close, and the divot by this point had sort of reached the same level as the other parts of the wound, and the sides were just closing and closing and closing, and became very, very thin. There was less than a centimetre across. And then week 4, this is the week where we are up to now, and it's closed, pretty much closed. The only little bit that I think has a little bit of healing to do is where that lump was. It's now attached and granulated. It was a bit of a flap situation for a while, but it is now nice and healed, and he has a scar. And it's a very neat scar. I was worried that he would get a thick, dark, sort of rigid scar where we would likely not be able to cover that with fur, if that makes sense. However, he hasn't got his fur back yet. It's obviously still growing. The body was obviously concerned more about healing the wound than regrowing the fur, so I think that's going to happen in the next couple of weeks. I really hope it's going to happen in the next couple of weeks and cover up all that book grease. But yes, that bottom part is sort of just catching up, but he has a very nice simple scar, and is probably going to be covered by the fur when it eventually does grow in. I will say that the fur on the back half of the wound, so towards the rear of his body, actually regrew whilst it was healing, and the rest of the fur didn't regrow. I find that when rats heal from a surgery or being shaved, they tend to grow the fur back not all at once. You'll have patches that grow back, and then the next patch will grow back. So I'm hoping that soon we will see that wound closed up and the fur covering it. But yes, that is Kiru's story. I'm hopefully going to insert a clip in this video to show you what it looks like and how he's doing. But yeah, that is my experience with open wound healing. It was about 4 weeks from when we went to the vet and decided on open wound healing, and now he stopped taking his anti-inflammatory medication, I want to say about a week ago, because it was pretty much unnecessary by then, and I don't really like prolonged use of those anti-inflammatories because it can put strain on the liver. So we decided to stop. I have been giving updates to the vet at the start every couple of days, and after 2 weeks or so weekly. So I should be sending a picture to the vet today because it is Monday. And yeah, Kiru is doing absolutely great, and through the whole process he didn't even really seem to care. He kept it clean but not overly messing with the wound or anything like that. And we did keep him in the hospital cage for 2 to 3 weeks. For 2 weeks. 2 weeks he was in the hospital cage for. So we were actually in the middle of intros when this all happened, which kind of was to our advantage because they were already in a small cage. But it was also very annoying because they were ready to move up, but I was waiting for Kiru's wound to be at a good point before moving them up into the half cage. So now that his wound is closed up, then we can go back into the bioactive and they'll be opened out into the whole cage, which I've been looking forward to. But yeah, they were in a hospital cage for about 2 weeks. He was in Alaska because everybody was there because of intros, and that worked pretty well. And once I was comfortable and confident with the healing process, after about 2.5 weeks I think it was, he went into the main cage. But yeah, so I just wanted to show you, this is Mr. Kiru-chan. Kiru. And this is what his side looks like now. Let's see if I can get you a better footage of that. He is doing really, really well, as you can see. And yeah, I just wanted to add in a quick little clip showing you this little munchkin. This little munchkin who is facing this way. He's trying to hide from the camera. Aren't you, bud? But he is a good boy. Yes, he is. He's a very good boy. The bestest. That is my experience, and that is open wound healing. I hope it was helpful to you, and if you have an experience of this, please do let me know down in the comments what happened to your ratty and how long it took them to heal and all that stuff, and give some encouragement to anybody who is going through this with their rat and watching this video for help. You can do it, your ratty can do it, I'm sure you will be fine. I am sending you all the best healing vibes in the world, and I'll see you in the next video.